means that bathhouses are on their way to becoming legal in the city of Minneapolis. Dylan Boyer is a proponent of this. He's with the Aliveness Project. Dylan, thanks for joining me.
Yeah, absolutely. Thank you so much for having me on.
Okay, so just react. The city of Minneapolis is well on their way to legalizing these bathhouses. Obviously, that's something that you're celebrating.
Yeah, we are very hopeful today. The Safer Sex Coalition really has done a lot of work led by community members, Aliveness Project, and Outfront Minnesota to make sure that we have accessible spaces for folks to be able to have sex should they want to. But really, our mission and goal is to be able to come through with a public health message and to be able to assure that our policies are aligned and they are not based in fear or stigma.
So the proposal, I just want to be clear, does not immediately legalize bathhouses if this does go through, but it sets the rules for zoning, licensing, health, and sanitation. So it opens the door for it. This ban has been in place since 1988, and that ban went into place during the AIDS epidemic. I've heard many proponents say that the ban really created a stigma. Can you talk to me about that?
Yeah, I mean, the ban itself, we understand where the ban came into place during the height of the AIDS epidemic. However, the ban staying where it has been for the past almost now 40 years really is outdated. And one of the testifiers yesterday at the city council put it perfectly that when COVID came around in 2020, we put laws and policies in place. We learned about this disease and we removed those laws and policies that were enacted in 2020 because we understood the virus and the disease more. Now, when we look at HIV in 1988, we didn't have that same understanding. Now we know what the virus looks like, how it's transmitted. We have a lot of advancements around HIV prevention, and we know that when people living with HIV reach an undetectable virus level, that they cannot transmit the virus to their partners. And so even though we've had all of these biomedical advancements, these policies are still in place today, and we are just curious why. And so we've been fighting for years to be able to remove and repeal this language from the city ordinance.
Now, opponents would compare this to a brothel, saying, if you're allowing people to come meet up and have sex in a location, that's a brothel. Why do you not define this as a brothel? Why don't you put that in the same category?
This is not a brothel because this is just a venue where people can meet up. There are a lot of accessible spaces that they can do there. There would be a sauna. There's the public health aspect. Most of these spaces have a gym, and that can be membership based as well. And so what the definition of a brothel is and what the definition of a bathhouse is are very different. We want to make sure that these are safe spaces for people to access, and that would be in the health codes and in the zoning codes, working with the city of Minneapolis, working with lawmakers to make sure that these are the safest spaces for people to have sex in, should they wish to want to engage in that.
What do you say to people who just are generally uncomfortable by this idea? You've heard people talk about, listen, there are kids in these communities, there's schools, there's churches, and it just makes them really uncomfortable thinking about people meeting up and engaging in sexual activity.
Yeah, I mean, to those people, you do not have to go to a bathhouse. This is an option for you to enjoy if you want to. I would also say that Minneapolis is a rich tapestry of a lot of different businesses that exist in our spaces. Everything from bars and clubs to places of worship, to libraries. And I know that there are, adult entertainment venues here as well. And so that, our city is already rich with this type of culture that exists here. And so nobody from the Safer Sex Based Coalition is saying put these venues next to schools. That is not where we're at, and we are excited to work alongside the zoning committees around what would the future of a potential bathhouse look like in Minneapolis.
The mayor will have to approve this. Do you have any idea of whether he will approve something like this?
That's a great question. The mayor was with us in the committee hearing yesterday, and so he was hearing some of the public testimony. And in a recent NPR article, he was quoted that he is in favor of passing this legislation, which we are excited to hear that he is in support of this. We've heard from his office that he wants to make sure that there are kind of four guarantees that would be happening if we are working on this building a bathhouse together. One of it is no alcohol on site, no drugs on site, making sure that people are trained in de-escalation and different motives, and that there is a public health entity involved in the bathhouse as well. So.
I've heard people say, look, people are doing this, behind closed doors already. There are, unlicensed establishments where people are meeting up. So you would argue that this is a safer way to go about this.
Absolutely. These activities are already happening. And whether that they are in parking garages or in somebody's home, or in businesses that are not established for this type of engagement. And so our hope is that by having laws and regulations so that these spaces can exist, that it will greater help the community be able to have safe spaces, clean spaces that have fire exits and codes and capacities, and that also have that public health message that we can provide HIV testing, condoms, education about prevention, and resources right there on site for folks.
Other cities have bathhouses. I mean, Duluth has the family sauna, which has been around for, oh my gosh, forever. Forever. How much have you guys looked at those other cities and their ordinances surrounding bathhouses and their actual facilities when you were going about this proposal?
Yeah, we are so proud of the authors of this ordinance that they have taken the time and the resources to do the work to bring us to this point. And so we made sure that we did a full research on what do bathhouses look like in Chicago, in San Francisco, in St. Louis, and in other areas to really kind of get a breadth of understanding about the different policies and ordinances that go into this work. And so this is something that has deep research done by city council members and city staff. And that is why we are at this point today, is because we have taken the time and the necessary steps to bring people along with us, and that we are not doing this work alone, and that we can reach out to our neighbors in Chicago and in Duluth and other spaces around questions that might come up. And so there is extensive research that has gone into bringing this forward to City Council.
All right, great. Dylan Boyer with the Aliveness Project. I so appreciate your time today. Thank you.
Thank you so much.